You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures. If you're headed to dentures or if you currently have a denture, you have to hear what he has to say. He is a board-certified oral surgeon, an expert on this topic, Dr. Graves. Dr. Graves, welcome to the program.
Thank you, Randy. It's really been a pleasure to be invited here and to be here.
So this is all you do at your center. I guess how it's normally done is you go to one place that does the surgery, you go to another office that puts the teeth on top, and maybe somewhere else for the imaging. You do it all right there.
All right there.
Is that right?
Right. We have a team that follows the patient from the day they come in the door to get them information on how we do it. They image the patient. They have a prosthodontist meet the patient, evaluate the case to find...
Prosthodontist is the one that makes the teeth look
right.
good.
The prosthodontist is the architect. They're the architect and the artist.
And it's all right there.
And it's all right there. And
so it's true, though, that people at a ClearChoice center, like at your center, they can walk in on the day of the procedure with no teeth, walk out with permanent teeth that don't come in and out.
That's correct. That's what ClearChoice is about. That's our message. That's what we do every day.
Now, you said you're on a crusade in the green room. I'm paraphrasing you slightly. You say, I'm on a crusade to wipe out dentures.
That's correct.
Is that right?
Why? That's what keeps me going. Because I've never seen a happy denture patient. People tolerate dentures. They tolerate something that's removable, like you tolerate an artificial leg. But to get your teeth back, that's amazing. I mean, with the technology we have and the techniques we have, you can get the teeth back, and then ClearChoice, they can do it in one day. In my private office, we can do it in weeks. And when I look in a mouth and see an implant-supported crown or tooth, I can't tell it from a regular tooth. And that's amazing. So these patients, after 20 or 30 years of having dentures or things that come in and out of their mouth, what we call removables, partials, all of a sudden one day they walk out with teeth.
How soon can they eat, by the way?
They can eat the next day. There's a little healing involved. For the first 24 hours, we like them to keep it fairly soft. Soup, jello, yogurt, ice cream, milkshakes, things like that, some fun things.
All right.
After that, basically anything you can cut with a fork, you can eat for the first few weeks.
You can eat meat and things like that?
Absolutely.
And when you're all healed up?
An implant is 5 times as strong as a tooth once it integrates.
Okay.
So we're not talking about one implant per tooth. We're usually talking about 4 or 5 implants for a whole jaw of teeth. But
so a full arch of teeth supported by 4 or 5 implants.
Correct.
Is what you normally do?
Correct. That's
do they like the eating part of it? The fact they can eat whatever they want? Or do they like the fact that they have good-looking teeth now?
You know, I would have to say the smile is a driving force, but you know, they like both. Think of it as something that you haven't been able to chew anything that you like for 20 years, and all of a sudden you can chew it without thinking. But more than that, you can smile, and so many of our patients never did smile. They put their hand in front of their face, they cover their upper front teeth. A lot of them work with the public. A lot of them were administrators, people that actually did public speaking. And they're talking without a smile, without a grin. And they got used to it. And after they get these teeth in a day, then all of a sudden, they actually want to show their teeth. They actually learn to smile. They start smiling again. They start smiling again. And they come in the next week, and we see them smiling again. And some of the pictures I show you, they look more animated. I didn't tell them to get animated. They just do it naturally. They've got a great smile. It looks perfect. The prosthodontist has done a great job of making the teeth look natural, and they want to show it off to the world. They are driven, and they'll come into my waiting room, and they'll sit down next to prospective patients, and we don't have to say much of anything. These people are so motivated because they've really
They start talking in the reception area?
Absolutely. I love them to come back, and some of them just drop in for coffee because I know we love to have them there, and they'll talk about their experience, strength, and hope about what's happened. And it's a life-changing thing. I mean, that's the thing about it. And the frustrating thing to me as an oral surgeon is the fact that so many people don't understand and how this can be done. And we have the technology, we have the techniques, and
they just don't know their options?
They don't understand their options.
Are there a lot of denture wearers out there, by the way? Like where you are?
There are
within 100 miles? Like tens of thousands?
Yes, many. Within 100 miles of Washington, D.C., we could probably fill Redskins Stadium 10 times over with denture wearers. You know, 50% of the population in the United States has a denture or a removable denture. 50%. That's 300 million people, half of those.
So if it's so good and there's so many people out there wearing an upper or lower denture, why aren't they all coming in to do this then? What's your take on that?
Well, first of all, if they're wearing a denture, they're not used to going to the dentist regularly. You know, they've had the dental experience, they've lost the teeth, they've had the root canals, they've been told they need periodontal surgery, they've had crowns patched up, and so all this has ended, and they're in a set of dentures. And once somebody's in a set of dentures, they're sort of out of the dental treatment loop. So they don't go to the dentist regularly. So they're not aware of some of the newer technologies and
so they don't know their options.
They don't know their options. They don't know their options, and they should. And where a lot of them get their options, believe it or not, is not from the dentist because they're not there. They'll see it on TV. They'll see it from their next door neighbor. They'll see it from a relative. We see a lot of relatives from out of town. We've done the procedure, and all of a sudden their uncle shows up from Poughkeepsie.
Okay.
There's no ClearChoice in Poughkeepsie, but he comes down because they become raving fans with the procedure. So yes, the information a denture patient gets is not from a recently trained dentist or somebody who stayed.
Okay, so if you're wearing a denture, you don't go to the dentist anymore.
Right.
But isn't it true though? If you have bad gums, you can't do this.
No.
Like people that are about to lose their teeth, with the bad gums, they could still get dental implants.
Absolutely. Those are a vast majority of our patients have problems with periodontal disease, but that implants are the end of gum disease in most cases. The gums aren't what holds the implant, it's the bone. And what we find is that the implants don't support gum disease. So it's sort of an immediate cure for most forms of gum disease.
So when you extract those teeth, a lot of the gum disease goes away.
Right.
Because it lives on the tooth?
Correct. A gum disease caused between a bacteria and the root of a tooth forming a film. If you take that tooth out, the tooth root out, basically the bacteria go with it, you have an implant. The implant's fused to the bone. Okay. There's no gap for the bacteria to get in and create gum disease. It's very rare to see an implant patient with gum disease. And yet, virtually all of our implant patients, and not just the patients that we do full arches on, but even single tooth implants, they will have some form of gum disease when they come into our office. And that's the end of it.
So you take care of that.
Right. And that's why the periodontists all do a lot of implants, because their job is to stamp out gum disease. Well, the best way is to place implants.
How old can you be, by the way? Back to the denture wearers. If you've been wearing dentures 30 years, isn't it true you may not have enough bone, or you don't have enough bone to get this done?
Boy, that's exactly why. That's the patient I love. Somebody who's had a denture for 30 or 40 years, they have no bone. They've been told they're going to have different grafting techniques, that it's going to take a year and a half, there'll be a lot of soreness. It's no longer true.
So you could work with those people?
I see them every day. Back to your original question about why denture wearers don't seek treatment right away. Number one, they've had some bad experiences. They are scared to death of going to a dentist. They're scared to death of staying awake in a dental chair and hearing all these lousy sights and sounds that they heard in the past. They've self-diagnosed. They think that maybe they're too old to have implants. My oldest patient is 98 years old.
Why would a 98-year-old want to do this?
Well, think about it. You're 98. What do you have fun doing? Eating. You have fun eating and socializing, right?
All right.
What can't you do with dentures? You can't eat what you want. You can't socialize. Try telling a joke and laughing and have the denture come out of your mouth.
Yeah.
My mother is in a assisted living. The average age there is probably 92, 93. And some of these people, they lose their dentures. They're afraid to talk. They talk with their hand over their mouth. She's got every tooth in her mouth. She has
her own teeth.
She has her own teeth. She's lucky. But so many patients don't. But there are patients there with implants, and they don't have to worry about losing their teeth. They don't have to worry about laughing at a joke. They can eat anything that's on the menu. And the menu is very varied. They have the mechanical soft menu for patients with dentures, and they have the steak, and they have the lobster. And my mother orders that. And that gives you that ability to not have these social fears that something bad's going to happen.
But I know a couple of denture wearers, right? They don't complain at all. Are you saying there's no such thing as a happy denture wearer?
I'm saying it's a frustrating existence. I mean, you can't do water sports with dentures. You can't. Kissing is a lot different with dentures than without dentures. Socializing, not sneezing in public is a lot different. they aren't part of you. Some people get very good at wearing dentures, but they're not their natural teeth. They always know they're wearing dentures. You don't have to get good at wearing dental implants. Dental implants are part of you, just like teeth are. You brush them just like.
Is this the future of dentistry? Like whether it's 20 years or 40 years, that dentures as we know them today will all be stabilized by something? Is that what you think?
Randy, I'm so glad you brought that up because I'm passionate about dental implants are the biggest thing that ever happened to dentistry. They allow us to replace one tooth, a whole mouth of teeth, and be restored and give the patient the same functionality and actually give them better looking teeth than they might have had when they were 25. My patients tell me that. I see them the next week to do post-operative checks because I've done the implants, right? And hi, how you doing? How's it going? Did you have any problem with soreness? You know what they want to talk about? They want to talk about their teeth. They want to talk about biting down. They want to talk about eating a hamburger. I mean, when was the last time you talked about eating a hamburger? Was that a big deal to you?
Yeah, no.
Wear dentures for 20 years. It's a big deal the first hamburger you eat. And it's so.
Do they ever say, I should have done this years earlier?
A lot. They do. And it's not cheap. And a lot of them have kids they have to get through college and other obligations.
You have financing available.
Oh, we have, yes. And I don't get involved with it, but they have 3 or 4 different methods of financing. Just like if you buy a car, right? The average car costs $32,000 today.
All right.
I still see people driving around in cars, okay? And they drive to my office in cars. They don't come in a bus.
Yeah.
Okay.
Yeah.
So ClearChoice does make financial arrangements with them. But basically, they say, I didn't know this existed. I didn't know how good it was. I never knew I could do this. This is what I hear from my patients.
We were talking in the green room, and that because you do a lot of advertising, ClearChoice does, they see it on TV, and they come in, and they're still skeptical, you say. Like they'll say, are you sure? I mean, can I really do this?
Right. Well, it's like anything. You know, if it's too good to be true, you've got to watch out for it. But when they're doing advertisements on TV, and in Washington, D.C., I have an advertisement with one of my former patients.
And those are all real patients?
They're real. They're real. I got his picture right here. Okay. I talk to him every month. He comes in, he eats an apple in my waiting room.
Just to show off.
Just to show off. Ron he's an amazing guy.
In front of the other patients, he's eating apples. In front of the other patient. And I'll show you his before and after. He looks 10 years younger, and he does things that he's... We're going to go to those before and afters. We're going to take a quick break. We come back.
Okay.
More about the process. You're watching The Wellness Hour. I'm Randy Alvarez. No more dentures. We'll be right back.
There's a way to improve your overall health by addressing your dental health. The ClearChoice way.
My cardiologist said, I don't want you to come back and see me again until you start getting something done about those teeth. That is the foundation of good heart health.
We're doing amazing transformations, and it's not just a smile, which is huge. Changes their person's total outlook. Function is better. Chewing, if you can chew your food, you're going to be able to chew better foods.
Most patients don't realize that their dental challenges can lead to serious health challenges. At ClearChoice, we understand that your dental health impacts your total health.
Feeling good and knowing that you're doing the best for yourself and for your own personal health, that is what's important.
Not just another dental procedure. This is a true life changer. The ClearChoice way. Call today to schedule your free consultation.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest, oral surgeon, says no more dentures. Nobody should be wearing a loose-fitting denture. And for those people that are headed to dentures, bad teeth, bleeding gums, bad breath, he says he could help those people too. Is that right?
That's
and welcome
right.
back to the show, by the way.
Thank you. Thank you.
So you could be, you say, your oldest patient's at 98 years old.
98 years
They're
old.
not more likely to fall out if you're 98?
No.
Statistically?
No, statistically.
Okay.
There are very few things that affect the success of the modern dental implant. Diabetes does a little bit. A lot of steroid use. And age, but these are all very slight. An implant takes 97% of the time.
Okay.
And there's not
so
much.
Most of the people that come in, if you're in your 80s, you have a little bit of osteoporosis. You're on a few medications. So they're still candidates? Okay.
And most of them aren't on just a few. A lot of them are on a lot of medications.
All right.
Yeah, they're still candidates. And a lot of them have a very similar story. They're frustrated. They don't think there's help out there. They're tired of going to the dentist and just getting one tooth patched and getting it removable, readjusted.
Now, for the sake of time, you brought some photos. Let's try to get through a few of those. What would you bring?
Okay. Well, the first one is Perry, and Perry is a private school administrator, and he came to us, and he has a long dental history of teeth being patched, of wearing removable partials, of lisping when he had something covering his palate, of bad breath because he was diagnosed with periodontal disease. And so he'd sort of had the full gamut of dental problems. And he came to us at the age of 61.
So he was headed for dentures.
He was headed for dentures in a hurry.
Okay.
And at 61, he said, I want to make a change in my life. I've got another 10 years at my school, and I want to. And basically, he came, and that's Perry today. And in one afternoon, he walks out with these teeth.
Very nice.
Yeah, and that's his smile. And that's when we saw him a week later. And he's you can tell the difference. I mean, he's a happier person. All of I have a lot of before and afters. They're all happier afterwards. I'm not telling them to smile in the photos. They're animated. They love their teeth. They want to show them off. Look at Perry. Look at the before and after side by side.
All right.
Okay. Before, he had gaps in his teeth. There were missing teeth. He wasn't smiling much. He'd grown a bigger mustache to hide things. Here's his after. He's got full set of teeth. They fill his whole smile. There's great what we call lip drape there. It looks very natural.
They do look like natural teeth. I'm not trying to side with you here, but that looks pretty good.
The smile's the key to life, the key to every social situation. If you don't have a nice smile, you feel funny about it. And if you feel funny about something,
You don't smile.
you don't smile.
You hide it. Now you have more photos. We got to rush for those.
Yes, I do. Yes. This is Michael. Michael's 51 years old. He's very active. And Michael had a bad problem with periodontal disease.
Okay.
It was an inherited tendency. It ran in his family. And by the age of 51, his teeth were severely compromised. His chief complaint was how his breath smelled. He's a very active person. He's very athletic. He does a lot of different things with groups, and he just felt funny, like his teeth were letting him down. He didn't have a good smile, and he felt people could almost smell him coming because of periodontal disease. And so what we did with Michael, we took
Because he was headed for dentures too?
Oh, he was headed for dentures in a hurry at 51, and with an active, non-smoker, active, healthy lifestyle, genetically had periodontal disease.
So in one day, this happens.
Yes.
Is that right?
And we do that one day. He walked out that afternoon, and that's what happened.
With teeth.
With teeth and a smile.
Now, some centers, by the way, and because I've had them on the show, and I don't know who to believe. I'm not the expert on this.
Okay.
But they'll say, Randy, you got to put the implants in, let them sit in there 6 months, 8 months before you put the teeth on top. Mm-hmm. Right.
Right.
And you're so philosophically, you don't do it that way.
Right.
You used to do it that way, though, in your private practice.
Randy, I was there. That's the way we used to treat every case. We used to bury an implant under the gum for 6 months, and then we'd see if it was ready for a tooth.
But that's still happening all over the place today.
It is. And the problem with implant dentistry is you do it one way, and it works, and you're happy with it, because it's so good. Even that is so good for the patient. But now, for the last 15 years, we have newer techniques where implants can be immediately loaded. You said it
so they walk in without teeth, you can put the implant, put the full arch of teeth, they go home that day.
Is
that right?
The national, international meetings that I go to, and I go to a lot of them, some I talk at, some I listen to, the biggest topic now is immediately loading implants, immediately putting teeth on implants.
That day?
That day. And it's been done consistently for the last 15 years.
And you've done this over 10,000 times?
Yeah, I have.
So we're going to have to go to the photos because we're short on time.
All right. So this is David, and he was told that he was headed toward dentures. And you can see from his smile, his teeth didn't look good. They weren't very accommodating. He remodels homes for a living. He also does a lot of work for his church. And this is David before. This is after. He was in a hurry. He was on a mission down to Tanzania. So we expedited him through. And he left with that smile on his face when he left the country. And
you say they have to learn to smile.
Yeah, they do. They do.
Because they're not used to smiling?
Well, think of it. You've been not smiling and hiding your teeth for 15 or 20 years. And then all of a sudden you have teeth. You want to show them off. It's like a brand new car without a mark on it. Yes, and they have to. But naturally, they're so used to hiding their smile and not laughing and not being animated. I'd say the biggest change I see a week later, you want to know what that is?
What is it?
It's not that the swelling's down. It's the fact that I talk to these people and they're animated and they're smiling.
Like their personality's back?
Oh, yeah.
Charisma?
Yeah, exactly. Yeah, they're at the party or something. They cannot believe this lifestyle, and they can't believe when they smile, nothing moves, it looks great. And they'll grab a mirror there and they'll say, look at this smile, look at this, and show me. And I know exactly what it looks like because I'm the one that helped put the teeth in. But it's amazing, the transformation. I never saw that in my private practice. So we are changing lives, one person at a time.
Good.
And one day at a time. This is Rita, and Rita was concerned. She was she's single. She's 70 years old, and a lot of missing teeth. Headed toward dentures. She had a big cruise she was going to take with her girlfriends, and reunite with some girlfriends. So she wanted to surprise them. So this is what we did for Rita. And one afternoon, that's how she walked out the door, from having
what a
missing
pretty
teeth
smile.
in front. That's right, and you can see the smile, and the smile's not artificial. That is her. That's how she couldn't stop smiling that day. She was on a roll. Now this is Derek. Derek he's a life of the party guy. It always bothered him that he showed a couple missing teeth when he smiled. Yeah, he still smiled a little bit, but it was sort of a guarded smile, and they're just so much fun to be around. I mean, because we really have made a change. This last one. This is Ron. He's been missing teeth for 30 years. He had no bone. He was told by 4 different orals.
Like very little bone.
Like almost none.
Okay.
Like almost none. And we did a scan, and I went out and met Ron and his wife, and I said, well, you have enough bone for implants. And he said, you're kidding me. I said, no, it's there. We're going to put one here, we'll put one there. And I went through the entire case with him, met with him. We got a special model made. We actually do model surgery before we do surgery on the patient because we have that technology now. And so Ron was told he couldn't have implants by 4 very good practitioners in our area. Well, he now has upper lower teeth on implants. This is how he left that day.
Wow.
That's Ron. And that was 4 years ago. You can look at he's changed his life. I mean, and Ron's an ordinary guy. I mean, he has a drywall hanging business. He's a salt of the earth guy. But he is so personable. That's the Ron I know now.
So
Ron
they could eat like nuts, salads. I mean, it doesn't matter. I mean, like they could chew a carrot with their front teeth, like a raw carrot.
Yeah, we had a meeting. True story. We had a meeting last year where we invited some former patients and some prospective patients, and it happened to be in an auditorium, and because we had a lot of people who were interested at that time. So Ron says, "Well, I want to come on stage." He says, "But I want an apple." I said, "What?" I says, "Okay." He says, "What an apple?" He says, "I want to eat an apple in front of everybody." He says, "I love it." So Ron shows up with his apple, and we made him first off with the apple, even though, I like him to show up last because of his story. And he eats the apple in front of the whole bunch, and he says, I haven't been able to do that for 30 years. He says, I know it. He says, you don't know what that makes me feel like. And then he actually got me to cry. He said something nice about me. But it's so neat to see
That's
that.
good for you. Good for you.
It was. My wife was there, and just to think that I had a hand in changing this man's life, it's just amazing.
And there's a lot of people like this guy.
There's tons.
And they're all over
There are
the
tons.
place.
Fill up the stadiums with them. They're out there. They're out there right now.
They just don't know their options.
They don't know their options, and they're
they're afraid.
Right.
They're afraid, right? Because of what they've been through. Especially you. They're really afraid of the oral surgeon.
Well,
because you're in trouble when you get to the oral surgeon.
Well, where do you see an oral surgeon for? You see him get your wisdom teeth out. You see him get broken down molar out. So yeah,
This is good
sort of
news.
have a This is good news. I mean, I'm a guy in the team that you meet along the way. My job is to place a number of implants in the bone that are sturdy enough to hold teeth. And that's my job, and that's what I do. And that's what I do every day. But the mission is that patient walks out with teeth that day.
That day.
And with a smile.
That don't come in and out.
And now that I've always, for 30 years, I've called my patients every night. When I call these patients, I say, are you bleeding and you're in pain? They say, no, I'm looking at these teeth. I like that. They're little.
So all they want to do is talk about the appearance of their teeth.
Yeah, and they're looking in a mirror and they're talking to me on the phone about their teeth, and I want to make sure that medically they're doing fine, but they're so excited, and then I see that enthusiasm a week later, and they come in, and
So personality changes.
tons, and you know who notices it? Their friends notice it, and their relatives notice it. We do a lot of husband and wife come in, and
Is that
it
right?
seems
Okay.
like seems like the wives are the guinea pigs. They go to doctors more often. 2/3 of our patients are women because women go to doctors more often. But
So the guys are always in pain. They like at the last second.
yeah,
They call you guys.
And so many times we will treat the wives or the aunts or the sisters,
And then the husband comes in.
and the relatives come in, and they'll come in from out of state, you know, and that's amazing. Somebody comes across 3 or 4 states just to see me and my team at ClearChoice. Because they think we can change their life.
So somebody watching this, by the way, they
Right.
could actually be wearing a denture, and in a few days from now, like 3 or 4 days from now, if everything goes right, they have a full set of teeth. Is that
Yeah.
is that right?
Yeah. Well, there's a little wait list for the surgery, but yes,
But I mean, if
that's
they
correct.
came in,
if they came in within 1 week's time, they could have a full set of teeth.
they don't come in and out.
Yeah, teeth. Let's get this. To me, teeth don't come in and out. Okay, dentures come in and out. Removable partials that maybe go on some implants or on other teeth, they come in and out. But teeth are there
I
forever.
want to thank you for coming in, and one of the things we haven't mentioned is you're one of the most experienced guys doing this, and so I want to thank you for coming on the show. And it was great stuff, great info.
Well, great. No, I really appreciate it. And like I say, the only problem I see today is not getting the message out to the people that need it, that this is available.
Okay,
And
good.
it's great stuff.
All right.
It keeps me coming.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.